I'm Dr. Kenneth Levine. Welcome back to Health Talk. Again, we're streaming live on the web at www.tvchannel19.com. I'm here with Cindy O'Brien, one of my favorite lactation consultants at Plantation General Hospital. Cindy, I understand that there are some things that you're allowed to do and you can't. Tell me a little bit about the limitations you have.
Well, as board-certified lactation consultants, we cannot diagnose. So that when we pick up a suspected tongue tie, what we have to do is share with the parent what we are seeing, visualizing, and how it could possibly be impacting her successful breastfeeding experience. And it does have a big impact on comfort for mothers, and it has a big impact on milk transfer. So it's important that we identify this and then share it with the parents and recommend that they go back to their pediatrician and discuss it with the pediatrician.
Well, I want to talk a little bit about that chain of events, because I know that there are parents who have tremendous frustration trying to get their pediatricians to refer them for this. I spoke with a mother from Sarasota who told me about a terrible 6-month journey she had from pediatrician to ENT, trying to get her baby taken care of, and she knew because she had breastfed 2 other babies before. Now my youngest patient I've taken care of is 3 days old that came from the hospital. Did that patient have to see a pediatrician for the referral, or can parents come themselves?
They can come themselves. What we basically do is tell them what we see, and
Right.
then we can give them the names of some doctors that do the procedure.
Right.
And then if they want, they can follow up on their own. They do not have to go through their pediatrician.
That makes it easier for them. For me and for all of my staff, taking care of these infants is one of the most joyful things we do in our professional life, because the results are so immediate. It doesn't take months to see the result. It takes moments to see the result. And I know it's life-changing for the baby and also for the mom, so they don't have to experience all the difficulties that you talked about and that have been related to me. Is there a way that you can communicate this better to the pediatricians? I'm sure you've tried over the past 15 years.
There has been articles in many of the pediatric journals basically identifying the effect of a tongue tie on breastfeeding, and I'm just hopeful that as breastfeeding becomes more important as a medical issue, not just as a feel-good thing. Breastfeeding is a health protection benefit for moms and babies also, that more and more doctors will understand that it may not be that typical heart-shaped tongue with the thin piece of skin that's so easy to pick up, that the posterior ones quite often, they don't want to admit that that has an effect, because if the baby cannot elevate his tongue, he's not going to be able to breastfeed successfully. And in order to breastfeed successfully, he has to drop his jaw and have a wide gape. And with a tight frenulum, posterior frenulum, once they drop that jaw, it automatically pulls the tongue backwards.
Correct.
And then it's like the baby is biting the mother, so it's very, very painful.
Right.
Plus, the baby is not able to milk the breast properly to get a good flow of milk.
You know, it's an incredible thing for us. It's even more important for the moms and all important for the babies. And I look forward to continuing working with you and your colleagues. So it's Dr. Kenneth Levine. You can visit my office in Tamarack for a complimentary exam, consult, and radiographs. Visit our website at www.drklevine.com. Good night.
When you're smiling.
First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.